Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX. On today's show, we are speaking with Heidi about Chiari Malformation. Thank you for joining us today, Heidi.
Hi, Heidi.
Hi, Heidi. Good morning.
Hi, guys.
Heidi, can you please tell our listeners what actually Chiari Malformation is and how it has affected you?
Well, according to the National Institute of Neurological Disorders and Stroke, Chiari Malformation has several different causes. Most often, a Chiari Malformation is caused by a structural defect in the brain and spinal cord that can occur during fetal development. This is called primary or congenital Chiari. It can also be caused later on in life if a spinal fluid is drained excessively from the lumbar or thoracic areas of the spine, either due to traumatic injury, disease, or infection. This one's called acquired or secondary Chiari Malformation. Primary Chiari Malformation is much more common than secondary Chiari Malformation. Chiari Malformation, also known as Arnold-Chiari Malformation. I was diagnosed with Chiari in 2006. After getting an MRI for drop attacks and frequent blackouts, and they discovered I had Hydrocephalus. They freaked out, sent me to a neurosurgeon that day. The neurosurgeon told me that I was at risk of having a stroke and dying without the surgery.
Oh,
geez.
Oh, wow.
Wow. And
so not knowing anything about Chiari, not even able to pronounce it, I made the decision then and there that I needed the surgery.
Okay. So was that the first time that you went for testing and got the diagnosis, so it was really all in one swoop?
Throughout my teenage years, I had chronic headaches and blackouts, but every time I went to the doctor, I was told that I was either being a lazy teenager and didn't want to go to school.
Oh, boy.
Or that I had a sinus infection and draining that was causing vertigo.
Okay.
Oh, I'm so sorry.
Oh, that's horrible.
But that's a very typical response.
Right.
Chiari is a difficult condition to diagnose.
We were just talking about this earlier. It seems like when doctors don't know, rather than saying they don't know, they have to give it a label.
Right. And yeah, maybe instead of saying it's blankety blank or it's your fault. I mean, I can't imagine a physician or a healthcare provider saying it's your fault, and that's basically what they were doing to you. They maybe instead need to say, I don't know, let me refer you to someone who might know, or let's work collaboratively with other healthcare providers who maybe together we can come up with a solution. But I'm really sorry to hear that that's what happened.
Right.
And Heidi, you said that you were having drop attacks, blackouts, and vertigo.
What is a drop attack? I don't even know what a drop attack is.
Like with POTS.
Oh, well, you pass out.
Yeah, right? A drop attack, or like you just suddenly lose all muscle control. Is that correct?
Well, to me, it'd be like you're staring at a telephone pole and it's going vertical.
Oh.
All of a sudden, for me, it would be horizontal.
Okay.
And my body's natural reaction was to correct it.
Oh,
and I hit the floor.
Oh, okay.
That sounds painful. And you said that there were headaches as well. Were there any other symptoms that maybe that you didn't associate with this condition, but that you were having at the time?
None that I can think of.
Okay.
And I know that that headaches are a hallmark sign of Chiari Malformation, especially after sudden coughing, sneezing, straining. What other symptoms does the National Institute of Health mention, Heidi?
Neck pain, hearing problems, balance problems, muscle weakness, numbness, dizziness, difficulty swallowing is a big one, speaking, vomiting, ringing in the ears, tinnitus was very common. Scoliosis is common, insomnia, depression is a huge one we deal with.
Okay.
And problems with coordination or fine motor skills.
Sure.
Infants with Chiari Malformation may have difficulty swallowing, irritability when being fed, excessive drooling, a weak cry, gagging or vomiting, arm weakness, stiff neck, breathing problems, developmental delays, and inability to gain weight. In my case, it was just a drop accident.
Sure. And in your case, it really started in your teen years, correct?
Mm-hmm.
I mean, at least the headaches did, right?
Yes. And
Okay.
I wasn't diagnosed until I was 21.
Okay.
Heidi, research says that there are 4 different types or forms of Chiari. Can you tell us more about each of those?
Yeah. According to the National Institute of Health, Chiari malformations are classified by the severity of the disorder and the parts of the brain that protrude into the spinal canal. Chiari malformation type 1 occurs in the lower part of the cerebellum, called your cerebral tonsils, extend into the opening at the base of the skull, known as your foramen magnum.
Mm-hmm.
Normally, only the spinal cord passes through that opening, but in Chiari type 1, which is the most common form of Chiari, it may not even cause symptoms. It's usually first noted in adolescence or adulthood, often by accident during examination for another condition, like when an MRI is performed, like in my case.
Mm-hmm.
Adolescents and adults who have Chiari may develop signs of the disorder later on in life. Generally type 2 Chiari is more severe than 1, and individuals with type 2 Chiari usually have symptoms during childhood. It can cause life-threatening complications during infancy or early childhood, and treatment generally includes surgery.
Okay.
Type 2, also called classic Chiari malformation, both the cerebellum and brainstem tissue protrude into the foramen magnum. Also, the nerve tissue that connects the 2 halves of the cerebellum may be missing or only partially formed. Type 2 is usually accompanied by a form of spina bifida that occurs when the spinal canal and backbone do not close before birth. This condition usually results in partial or complete paralysis of the area below the spinal opening. Then there's Chiari type 3. This form is very rare and the most serious form of Chiari. In type 3 patients, some of the cerebellum and the brainstem stick out or herniate through an abnormal opening in the back of the skull. This can also include the membrane surrounding the brain or spinal cord. The symptoms of type 3 appear in infancy and can cause debilitating and life-threatening complications. Babies born with type 3 have many of the same symptoms as those with type 2, but can also have additional severe neurological defects such as mental and physical delays and also seizures.
Mm-hmm.
Finally, there's type 4. Type 4 involves an incomplete or underdeveloped cerebellum. In this rare form of Chiari malformation, the cerebellum is located in its normal position, but parts of it are missing, and portions of the skull and spinal cord may be visible to the outside.
Okay.
Wow.
And you say that which type did you have particularly?
I have type 1,
Okay.
which is just the most general.
But
most
you
common
had
form of
hydrocephalus, you said? What is that?
Hydrocephalus is the buildup of spinal fluid around the brain.
Okay.
So if you think about it, my brain was like, my cerebellum was corking my foramen magnum,
Mm-hmm.
and all the fluid was building up, and nothing was flowing down my spine, so my spine was dry.
I see. Okay.
Yeah, and that
you
had to
use
have
a-
been painful.
Right.
Do people with type 1, would they use a shunt to drain the fluid?
Sometimes a shunt is used if decompression surgery isn't enough.
Okay.
Okay.
And Heidi, had you said that this was obviously a shock to go to the doctor and find out that you need immediate surgery and that it's a life-threatening condition. Had you ever heard of Chiari malformation? You said you didn't even know how to pronounce it. I don't think many people, unless it affects someone in your family, you wouldn't have heard of it before. And since there is a genetic component to this condition, after your diagnosis, did you realize that anyone else in your family had it, or do you know anyone else that has this?
I had no idea. I'd never heard of it. My ex-husband and I couldn't even pronounce it.
Mm-hmm.
We went home and tried to Google it. We couldn't even remember what it was called.
Right.
I called my family and told them that I had to have brain surgery, and my cousin had just had an AVM,
Okay.
Arnold-Chiari Malformation,
Mm-hmm.
and she ended up paralyzed.
Oh.
So when my family heard I needed brain surgery, they all freaked out.
Oh,
The only
Understandably.
Right.
The only neurological issue in my family is my cousin with the AVM.
Okay.
Mm-hmm.
So I've had my dad and my mom both checked,
Mm-hmm.
and they were clear.
Okay. Well, did you have any injuries? Did you sustain any injuries or car accidents or anything of that nature before your diagnosis? Could it have been trauma induced?
Not that I remember. Memory loss is a big thing with Chiari too.
Sure. Okay.
I don't remember. I mean, I
Right,
was
right.
a flipper in cheerleading in high school.
Oh, wow.
You were a what?
A flipper?
What's a flipper?
I did all the stunts and
Oh,
The ones that get thrown up in the air,
but
right?
I don't remember ever getting hurt.
okay. Do you remember ever falling like on your head?
Not that I can recall.
Okay.
I never was
'cause-
dropped as a baby.
Okay.
Oh, okay. All right.
Okay.
Yeah, because cheerleading is a real intense sport, and
Sure.
yeah, there's definitely that risk of traumatic brain injury, especially with flippers.
Right. I mean, it could have been something that, maybe you didn't even notice, but...
Right.
Right.
Wow.
And what procedures did you said that you ended up having surgery?
Yes, I had what's called a cranial decompression and laminectomy, where they remove a section of the skull surrounding the foramen magnum, making the hole bigger.
Okay.
And they also remove part of your C1 vertebrae, making more room for your brain and the fluid to flow.
Okay. And that was successful?
I'm alive.
Well, that's a good thing. That's always a good
They,
thing.
they did remove too much bone when they did my surgery, causing another condition called brain slump.
Okay.
But I did survive, and I was good to go for about 4 years.
Okay. And the headaches then stopped after that?
Yes.
Okay.
Okay. And how about dizziness? Do you continue to have vertigo and drop attacks and things of that nature, or have those cleared up as well?
For about 4 years, I was good and healthy.
Okay.
Okay.
Okay. Well,
All
that's
right.
good. And then what is covering that space that you said that they took away the bone?
Yes, nothing. Just your dura, which is the mucous membrane
Okay.
surrounding your brain.
Okay. All right.
Do you know if they removed any arachnoid tissue at the time? Any of the
Like
it's
scar
kind of
tissue?
It's kind of like scar tissue that can be blocking the flow of cerebrospinal fluid. And did they check afterwards? I'm sorry, I'm throwing in extra questions, but did they do an MRI to see what your CSF flow looked like before and after?
Yes, they
Okay.
did.
Okay.
And I was cleared.
Okay.
Okay.
All right. Well, Heidi, are there specialists for this condition in your area? And did your physician have a lot of experience with this condition? Or did you find that you have to travel for specific care?
I actually went to Yale, which is a teaching hospital,
Mm-hmm.
and the first neurosurgeon I saw was who did the Chiari surgery was a neurological oncologist.
Oh.
So he had said he had done a handful of Chiari surgeries.
He said what now?
He had done a handful of Chiari surgeries.
A handful. Okay.
Okay.
And at that time, having not heard of it and not knowing what I was facing, that was good enough for me.
Sure.
Well, yeah, it's hard to
there
know.
are specialists.
And Yale is a good hospital, so you would think that, somebody at Yale would, I would trust, right.
Yeah, I went into Yale. They were the hospital to go to
Mm-hmm.
in the Connecticut area. I mean, without going to New York City or Boston,
Mm-hmm.
that was the best option.
Right.
There are a handful of Chiari surgeon specialists across the country, and most people do have to travel.
Okay. Yeah. In my case, the first physician that I went to said that he had seen the procedure done before. And my mom kind of looked at him like, okay. And then she said, well, if it was your daughter, would you want to be the one performing this procedure? And he said, well, no, probably not. So we ended up having to seek out a specialist who does the procedure several times a day, which is a rarity.
Right.
Yeah.
Right. And he was a pediatric surgeon.
He was a
because,
pediatric
like you said,
neurosurgeon.
most of the conditions
Right.
happen at birth.
Right, and actually, he said Chiari type 1, he said, that's no big deal. And we were like, no big deal. We were just told, same thing, same situation where we were told that, it was a matter of life or death. and this was a serious situation, and that I believe the first physician said, try to get home safely.
Yeah. Yeah, it was panicky.
Yeah.
We understand where you're at on this.
Yes.
Right.
Heidi, can you tell us, are you in any support groups, or do you do anything online with different folks that may have Chiari malformation?
There's a great group on Facebook. Can I name it?
Oh,
Yep,
absolutely.
yep. I'm going to write it down, and we're going to put it on the
I was going to
website.
say absolutely, yes.
Okay. It's called Chiari Sisters.
Okay.
It's an amazing group. It's got like 250,000 members of
Wow.
all women
Wow. Yeah.
across the country and even international. I met a young woman from New Zealand the other day.
Uh-huh. Okay.
And with Facebook and other social media platforms, it's really easy to find support and people who have gone through what you're going through.
And when it's
There's also a
when it's something
walkathon.
that's that rare, it is important to go online, because that's where you can really resource the most information, I think.
And you were saying a walkathon?
There is a walkathon every September because September is Chiari Awareness Month.
We're going to one.
Yes, we are going to
Next
one
week.
on the 22nd.
Right.
Yes.
Right.
Oh, what state are you guys going to?
Illinois.
Illinois, nice.
Yes.
I'm doing the Connecticut one.
Okay.
That's wonderful.
Yeah, we've never done one before, but this is Jean just started walking again 2 years ago. She was using a wheelchair for about 14 years because of hers
wow.
being misdiagnosed for so long. And now that she's up and walking, we decided that we're going to start taking part in all of these things too.
Oh, that's fabulous. I'm so glad to hear it.
Yes. So, Heidi, have you found that there are different therapies that worked for you, like physical therapy, occupational therapy, especially recreational therapy? Ron and I are both recreational therapists. Anything that helped you, like, stay motivated and stay healthy during these procedures?
Not really. I hate to say, talking to two therapists.
I know. They're both looking like, no.
Well,
Nothing's really going to put my brain back in my head.
Sure.
we understand.
And
No
actually,
amount of physical therapy. And honestly, it just hurts to
Sure.
the point it's not worth it.
Well, sometimes recreational therapy could just be
distraction.
distraction.
Diversionary.
Yes,
Yeah.
diversionary. So
Yeah.
it doesn't have to be active. It could be.
It's not to fix or whatever, but it is to try and build you back up from a self-esteem standpoint. That's what we do with all of our folks. It's, okay, there's something going on, and we're not here to change it or fix it, but we're here to try to make you the best that you can be for yourself.
Right.
Well, in that case, music.
Good. There you go.
Absolutely.
Absolutely.
I think we hit her.
So how do
Yes.
you use music?
Reading. Yep.
Reading was a big one
Mm-hmm.
for me personally.
Mhm.
Any kind of distraction, I guess you could say,
Correct.
that
Right.
didn't involve physical movement.
Right.
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 Right. Well, actually, hearkening back to that without the physical movement, are you able to participate in physical activities that are either like a recumbent bike, so that you're sitting down and able to do physical activity? Have you found that helpful at all?
At this point, yes, but before, no.
Oh,
Okay.
sure.
Okay.
Okay. All right. And Heidi, how has this condition affected your relationships, your family, and are you concerned about a possible genetic situation here, and has that affected your thoughts about children and having your own children?
Well, it did cause a divorce.
I'm sorry.
My ex-husband couldn't deal with it.
Mm-hmm.
It's caused quite a few breakups, smaller relationships, and I decided that children just aren't for me.
Okay.
It's not. I don't want to pass this down
Mm-hmm.
if it is genetic
Mm-hmm.
and put another human being through all that pain.
Sure. Well, but you, I do understand that you do have a couple members of the family who are assistive and helpful and furry.
Oh yes, your your assistive dogs. Yes, your labs. What are your labs? What are the names of your labs?
I have Diamond. She's a 14-year-old yellow lab,
Okay.
and she's certified service dog. I'm also hearing impaired, So she helps with things like when somebody knocks on the door, she barks.
Okay.
Okay,
She'll
good.
come and get me. The phone rings, she'll come and get me. Somebody even walks by, she'll come and get me.
Okay.
And then we have Mystique, who's
Mystique.
a 1-year-old black lab, and she's in training now.
Okay.
Oh, great.
Very
Nice.
nice.
I'll take those kind of support.
members?
Yeah, I'll take those support people anytime.
And they're great around the holidays, I'm sure.
Yep.
I mean, Thanksgiving, you don't really have to argue with them, and they're willing to help with I cannot speak
Leftovers.
today. With leftovers and cleanup.
Right.
Yes.
There you go. Don't have to wash the dishes as hard with the dogs around.
You're
Yeah,
right.
that's-
You're right.
yeah.
I think that's an episode for another show. Heidi, can you tell us what advice you might have for our listeners, and especially for people who may have recently been diagnosed with Chiari malformation?
Mostly be your own advocate. No doctor is going to care as much as you are yourself. You need to have a backbone and stand up for yourself. When you know something's wrong, push and push and push until you get answers. And seek out a specialist, because I didn't and I regret it big time.
Right.
For 10 years, I was unable to move and bedbound because of the surgeon's mistake. So definitely make sure your surgeon knows what he's doing, and you have to have a backbone and be your own advocate.
Understandable. Definitely.
That's wonderful advice.
Excellent. And I think we're going to be talking to you again about what happened after the surgery. So that'll be the next episode. Heidi, thank you again for taking the time to speak with us today. If our listeners would like to learn more about you or Chiari malformation, if they wanted to reach out, how can they find you? Do you have an online presence?
I do. I'm on Facebook. My name is Heidi Marquis,
Okay.
and I will do my very best to help in any way I can, even if it's just a shoulder to cry on.
Thank you.
Well, again, we do appreciate you coming on this morning and telling us and our listeners your story, and best of luck to you.
All right. Thank you so much.
Thank you.
Thank you.
Well, that wraps up this episode. If our listeners have any questions or comments related to today's show, they can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you have a moment to spare, please drop us a line and let us know what topics you would like us to cover, what we can do to improve, what you wish we wouldn't say, all those comments and more. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Till next week.